There was one person actually that did both things. First of all, stimulated me when I was a pediatric intern back in 1970 at Children's Memorial Hospital in Chicago to think about hematology oncology. And I think that person I would also designate really as the key mentor that I had over the next 4, 5, 6, 7 years as I thought about it. Her name is Dr. Mila Pierce. And I was just reminded this morning that she was the first recipient of the ASFO Career Award for the work that she began back in the 1930s. So she got into the field in the 30s when there was really no treatment for leukemia, and her name was on some of the first papers in the late 40s and early 50s on treating childhood leukemia. She had been forced or asked to retire, I guess forced to retire in those days, at age 65 from her previous employment. So actually joined the faculty at Northwestern University in her early 70s, and she was the hematologist on the wards as the attending hematologist much of the time. And her skills in things like bone marrows and IVs were far superior to any of those on the house staff. So we would go down and look at blood smears and bone marrows together late in the afternoon and early in the evening, and I just thought that was pretty cool. I thought I wanted to be a general pediatrician, and so it was that experience with her, and she kind of kept tabs on my career over the next 8, 9 years, and it was fantastic. She was my mentor, and she was the first one who got me into this.
My first mentor was Audrey Evans, and she was totally charismatic. She had a cool English accent, and she could walk into a room of a dying child and just go over and comb his hair and make him feel better. And she could get millions of dollars out of Leonard Toews from the Eagles. And she presented oncology as the area, the growth field, and really was the golden age when everything we did worked. Oh, I had two other, she won the Lifetime Career Award, and then two other of my mentors, Dan D'Angio and Anna Meadows, did also.
I actually was a med student at Penn and took the Peds Heme elective with Frank Oski. Frank would probably roll over in his grave if he knew that I became an oncologist. But there's no question that he stimulated my interest in the field. And then when I went to Minnesota, Bill Krivit continued that incredible stimulation both in heme and in onc. I then found that the kids who crawled under my skin as a house officer were all cancer kids. In fact, many of them turned out to have AML. And I think it was a combination of that and then taking a Peds Onc elective there where I truly became smitten with what is a cancer cell. And I have to credit both Mark Nesbitt and Bill Krivit for that, and both of those also won the Distinguished Career Award.
You might add that Bill Krivit was the, I believe, first president of ASFO.
That is correct.
So, like Bill, I actually was both an internist and a pediatrician as a house officer, and probably the first people that brought me to this field were the patients. I had an adult patient with non-small cell lung cancer who I took care of until he died, and it was just an incredible experience, and a teenager with osteosarcoma who also really made me love the concept of how to take care of people in difficult circumstances. And that brought me to the field, and then later on I developed an interest in how to do clinical trials and the cancer cell. At the University of North Carolina, where I was, Campbell McMillan was the hematologist oncologist, and he was a clotter by training, but he had such ability to discuss and talk with people and deal with patients. He could never get from one end of the hospital to the other because he'd be stopped by 15 people on his way who wanted to talk with him about various things. And then when I got to Boston, Jeff was my lab mentor. That worked. Jeff Lipton, our current president. That worked out well. I've never been in the lab since. Howard Weinstein was my clinical research mentor. And for those of you that know Howie, he's an incredibly bright and thoughtful guy. And the things he taught me as I started to try to do clinical investigation were things that I carry with me every day.